Hey guys, what's going on? What's going on? Good afternoon. Today we are covering cardiology. As you know, it's the third week of July, and our cardio is always the first and third week. It's a tough topic like anything else, guys, but we have to always say to ourselves, what do we do to get the points, right? So whether it's about restrictive cardiomyopathies, you're talking about cardiomyopathies in general, anything with the valvular disorders, right? Obviously, we know about systolic versus diastolic murmurs, things that can increase and decrease preload. We have to just pick and choose, ideally, what we know versus what we don't. Now, I did talk to a few students earlier today, and realistically, what I would suggest is this. you know, we've all been at this for a while. We've studied, we've feeling tired, feeling exhausted. So when I work with students, and especially we have like less than a month to take a test, and they're trying to figure out, where we're at. My always go to is you could do a couple blocks of 20 or 40 questions in a specific block, a specific system, and to see exactly what's going on. Because if you ask me, Dr. Stavros, I don't know how strong I am in cardio. I don't know how strong I am in pulmonary. Well, you could do a random block, but a random block of questions is what it says. It's a random block of questions. So if you do a block of 40 random, that's cardiology, pulmonology, that's nephrology. It's a variety of things, right? But if you actually put yourself through a certain little examination assessment and say, well, I'm going to go see 40, 60, 80 patients in cardio in the cardiology department, then it's more of accurate feedback of how strong or not strong you are in the specific organ system. So if you went today or tomorrow and said, I'm going to do 2 blocks of 40, 4 blocks of 20, either way, 80 questions, 80 patients, and I will do these 80 patients. I will see these 80 patients, answer questions, and figure out how I do, how I perform. And then after you see your performance, then you can say to yourself, okay, is it the content that's stopping me, preventing me from getting a higher score, or there's something with my test taking? Either A, I read too fast, I overthought, I second guessed, I'm not too confident, I chose the second best answer, I got tricked, those kind of things, right? And I know I keep saying that over and over and over again, but realistically, this is what needs to be done. If you don't do it, then what happens is you will join the majority of the people out there, doctors, medical students, men and women, who are wasting their time studying when they shouldn't be studying. They shouldn't be reviewing content. They should be practicing more questions, because they knew about AV nodal conduction. They understood about systole versus diastole. They understand when the patient presents with their, like a click versus a snap. They understand that, right? But they just didn't see it in the question stem. So this is why it's important that whether you are at the beginning of your studies, in the middle, or during the end, you don't want to waste valuable time. So if you ask me, how do I know where I'm at? You can either do an assessment test or create your own and get an overview of exactly where you're at. You could do 3 blocks of 40 random timed in any preferred Q bank and see how you score. You score on 65 or less than 65, right? But if you realize you have some time to review and you want to go through system by system, the best approach I've seen and the most accurate approach and feedback I've seen with all my students I've worked with is you do a block, a section, 80 questions in every system will give you literally an accurate feedback of how strong you are in the actual organ system. Because honestly, if you do a block of 40, you might see 3 cardio questions and you get them all right. Yay, 100%. But you might get them all wrong. You're like, uh-oh, I got them 3 wrong. Yeah, but these are 3 patients. Versus 80 patients, you'll see more of cardio diseases, conditions, diagnoses, medications, and stuff like that. So do it that way. And I can promise you, like, wow, I'm actually doing pretty good. Then you figure out where your weaknesses are, and I've shown you before how to strengthen that. Either A, use your notebook, your notes, or you go back to doing questions and then move. So this is what you have to do. Today we're doing cardio, and it's a different, it's a difficult topic, guys. It's not easy, but we gotta know, we gotta see what we know, right? We gotta work together as a team. So I see Dr. T raise his hands. I want more people to raise their hands. So Dr. T is gonna do 2 questions. I want more people to do it. I see Dr. Singh. So because Dr. Singh and Dr. T. So T, I'm gonna have to do 2 questions. Singh, 2, 3 questions, round robin, right? Let's keep doing. I need you guys to work and participate because this is why we do what we do. All right, awesome. All right, so take notes, participate, and really let's hit it hard, guys. I'm here every day for you. I wake up every morning. I see people, I see doctors before I see our session in the morning, and now it's getting busy with step 2 and step 3. So let's push hard, let's succeed, right? Dr. T, jump on board, buddy. Let's do a couple of questions of cardio. How do you feel about cardiology, Dr. T? You feel strong? You tell me.
Or cardio, yeah, I mean, I feel a little bit good about it. There's always a few things, that need strengthening, but I think
So
I
let me
do.
ask you,
Mm,
but like what though? But like what? Because I mean, we're at the stage, guys, when you're studying, there's always going to be stuff you're not going to get. There's always going to be things you're going to forget. But what is it exactly that either A, you're really strong in, or stuff they kind of keep tripping on? Just we're all here as a team talking, right? We're family here. So what is it? Is it the medications? Is it the murmurs? What is it exactly?
okay, I would say the mamas were a big problem for a long time, but I'm actually getting them right because sometimes I'll read the stuff and sometimes you just need to pay attention like to the location, you know,
Mm-hmm.
like where the mama is. And
100%,
that
100%.
that was a problem because I'll know the description, but the location
Yeah.
where it is. So I've worked on that,
Okay.
on the
But that's
location,
good.
and
I mean, that's what you have to do, right?
yes, yes,
All right. So we have location, we have systole versus diastole. You need to
yes,
know they're going to explain to you certain radiating sounds if it goes to the carotids or like the mid clavicular line, like you have to understand where they're located. So we have location, we have systole, diastole. We also have characteristics, do we not? Like
yeah,
snap,
we do.
click, those kind of
Mm.
things, right? Okay, okay. What do you think about actual heart sounds? You think that they're gonna
Yeah,
get you on these
yeah,
things? You think it's gonna be very
yeah,
difficult?
yeah. They did get me. Like in my mind, like I had this one question that wanted to ask me, like, when is the sound, like if it's after S2 or before S2.
Okay.
So in my head, I was thinking it has to be, after S2, but I went for S1.
Okay. I mean, they got you, but then you say to yourself, okay, I would rather, I mean, realistically, you might get 1 or 2 heart sounds throughout the whole day. And one hard sound would probably be able to be answered by this characteristic presentation. The other one, they might be kind of messed up and say, hey, listen, what do you hear? But those are usually experimental, guys, because again, a lot of people get this wrong. You need years of practice to listen to hearts to pick up any abnormalities, right? Especially if you're checking your medical student. This isn't easy. Kidding me? They can't expect us to be cardiologists. How is that possible? So that's why it's a game you play, right? So don't get caught up in everything. Learn the locations and move, right? Yes. So I will share my screen and give you an example. As you were talking, I was looking at my first aid, and here it is. Boom, right? Auscultation, something we've seen a million times. This is what they're going to give you on the exam. They're going to express to you the areas, right? Systole versus diastole, holosystole. Then you have the apex. They're going to talk about the carotids. So if you don't know it, you have to learn it. And I've gone through this many times as far as the changes cardiovascular, murmurs that increase with maneuvering versus murmurs that decrease with certain maneuvers. You need to understand them. They will throw it at you. If they do, you'd be ashamed to get it wrong. It really would be, right? Okay. So, doctor, before I give you a heart attack, because I will throw a curveball at you, let's do this first question. And second one I'm going to give you, you will not like me, I promise. But then you're going to love me when you do well, right? So, those of us on the back end, let's help each other out. If you're able to participate, like I always ask you, type away, chat away, help each other out. Let's push. Let's get done with this exam. So, doctor, take it, man. Let's do it.
After the patient stands up suddenly, the click is heard during early systole and the intensity of the murmur increases.
Oh boy.
Which of the following is most likely underlying cause of the patient's examination findings? Okay. We have a 19-year-old woman comes to the physician for routine health maintenance examination. She appears well. Your vitals are within normal limits. Cardiac examination shows mid systolic click and a grade 3 over 6 late systolic crescendo murmur that is best heard at the cardiac apex in the left lateral recumbent position. Okay. So
That's a lot of information, isn't it? Isn't that a lot
yeah,
of information?
here.
Didn't
Yes,
didn't we
yes.
have, I mean, so they're slamming you with
Yeah.
everything. You're talking about, routine young girl, mid
Mm,
systole, click, click.
yes.
Grade three,
Yes.
six. I'm being honest. Step one, you really need to know about the grades. They just have it there just to be thorough. Main thing is the mid systolic click, late systole, right? Okay.
Mm,
Crescendo murmur and location. Best heard at cardiac apex in the left lateral recumbent position.
mm.
After the patient stands up suddenly, stands up. So from sitting, she stands up. The click is heard during early systole and intensity of the murmur increases. Talk to me.
Yeah, so this is a mitral valve problem, MPV, and if it stands up, the preload goes down and the murmur intensifies.
Okay, so MVP, and then clearly there's only a couple things you need to know. We've said this before. You guys know what murmurs are in systole, then we know which ones are diastole. Learn MVP, different conditions, right? So when you know that, it's one less thing to worry about. Okay, so it's MVP, 100%. We got MVP, right? Then you do this. If you're using Amboss, hit the tip to confirm when we're not all together, and said, oh, okay, mid-systolic click, crescendo murmur, clearly location gave it away. MVP, the maneuvers are your advantage to get points. So this is confirming MVP for us. So we don't have to spin our wheels and get things wrong. We're on the right track. Okay, cool. So I want you to knock out all the answers, because if you have the right answer, congrats, I'm happy. But the problem is we have 5 conditions in front of us. I am here. My responsibility and my duty is to make sure you guys pass this test the best way I can. Knock out every answer choice that is not the right answer, and tell me why.
Okay, mass and heavy chain effect. Yeah, that will be with the welcome.
This
And
is
it will be,
Holcomb.
yes, that will be in the left parasternal, um, the location, and it's also systolic. And this will knock that out because this mama is on the apex, and
So
it's not a mid click as well.
good, because I mean, you know why they put this as number one, right? Because this is Holcomb, hypertrophic cardiomyopathy. And actually, this heart murmur does what? It intensifies by standing up. So
Yes.
this person stands up, it intensifies. Okay, this is a good answer. Yeah, but hold on. This presents where again? What the location is where for this one? Or at least,
Um,
what does it sound like? What's the sound like for Holcomb?
for how come it's a systolic mama?
Mm-hmm.
It's in the left sternal border.
Okay. And this is actually a crescendo decrescendo. It could be. You're like, wait, that's aortic stenosis. No, I understand that. But this also presents with literally a systolic ejection murmur, typically to